Good afternoon. My name is David Rindge. I'm an acupuncturist, registered nurse. Been in healthcare for really as long as I've been working, nearly since the 70s. And we're just starting to administer laser therapy to Mary Lou. And we're treating Mary Lou's back. And we're using something called low-level laser therapy, which is something I think anybody who's dealing with any pain, certainly, and a lot of other healthcare issues really would do well to become familiar with. Laser therapy is safe. There has been no harm caused in more than 50 years of clinical and research use, and its applications across a broad range of conditions are fabulous in what they promise for people, for healthcare, and for life in general, the quality of our lives. There are a lot of reasons for anyone to consider laser treatment. And the first one is that laser is documented to regenerate tissue. Bone, blood, the lining of blood vessels, cartilage, anything that's in a joint capsule, pretty much any tissue that's not functioning particularly well that's exposed to laser therapy has been documented to heal. And on the same line, along with tissue regeneration, the scientists also like to add one other word. And that word is biostimulation, bio-life stimulation. Whoa, think about that. It's kind of what I would want for a treatment. Laser light directly adds energy to cells. Mitochondria, little organelle that are in all of our cells, but most often and in greater concentrations in muscle cells, nerve cells, any cells that have to do a lot of work. Mitochondria accept laser energy, other light energy, and they begin to produce a substance called adenosine triphosphate, ATP. The result is suddenly that cell, that tissue has energy and can do what it wanted to do. The result is, again, the regeneration of tissue. Laser therapy is also said to be anti-inflammatory. That's the second effect. But it is not an Advil. It isn't reducing swelling. It isn't making things just feel better. What laser actually does is move the body through inflammation into healing, into the proliferation phase and remodeling phases of healing, so that it shortens inflammation. Tonight, after we're done treating your back, Mary Lou, cells called fibroblasts are going to proliferate. That means increase in number, and they're also going to get very busy. Fibroblasts make collagen. Collagen, people might think of as something that sometimes is injected into lips, but it's actually the building block of your musculoskeletal system. And so the result is formation of new tissue. The collagen that's formed in response to laser treatment has been found in research to actually be more elastic and responsive in tendon injuries and other injuries. And so the third effect of laser therapy, cited in most of the literature, is pain relief. And there's a lot of reason to have pain relief. These lasers have a depth of penetration of 5 centimeters. They intersect all of the A delta sharp pain detecting fibers and the C fibers, which are more when you have a dull pain that you can't quite locate. That's usually a C fiber. Well, when a person's dealt with a lot of chronic pain over a period of time, the tendency by the body is to respond to this by almost becoming hypervigilant, by becoming very, very chronically in a state of trying to look for a way out of the pain. Laser therapy gives relief in chronic pain. It causes a neural blockade for the A delta and the C fibers, and at the same time stimulating the healing of underlying issues. So with chronic pain, there really isn't anything better. Most pain is done, in our experience, in 6 to 10 visits. And if you feel better, you probably are better.